Hey everyone, Dr. Mike here. We all have our little quirks and habits, and one of the most common is crossing our legs. It seems so natural, so comfortable, right? But what if I told you that this seemingly harmless habit could actually be impacting your health in ways you might not expect? That's right, folks. Today we're diving deep into the world of crossed legs and uncovering the potential side effects lurking beneath this widespread practice. From your posture to your circulation, we're breaking it all down so you can make informed decisions about your health. So if you're ready to learn more about the surprising ways crossing your legs might be affecting you, stick around. It's time to separate fact from fiction and get those legs uncrossed for a healthier you. All right, let's start with something we can all relate to. Posture. Think about how you sit right now. Are your legs crossed? Now imagine holding that position for an extended period, maybe while you're at work, watching TV, or even driving. Feels comfortable at first, but over time it can wreak havoc on your posture. Here's the thing. When you cross your legs, you're essentially tilting your pelvis. This seemingly subtle shift can lead to a cascade of musculoskeletal imbalances. Your spine, the backbone of your posture, can start to curve unnaturally, putting extra stress on your lower back and hips, and it doesn't stop there. To compensate for this misalignment, your body might overcompensate in other areas. You might find yourself hunching your shoulders, craning your neck forward, or experiencing tension in your upper back. It's like a domino effect, all stemming from that initial leg cross. The key takeaway here is that maintaining good posture is crucial for a healthy spine and overall musculoskeletal health. While occasionally crossing your legs might not send you running to the chiropractor, making it a habit can contribute to chronic pain and discomfort. Now, let's talk circulation. Our bodies are like intricate highway systems with blood vessels acting as the roads that transport vital nutrients and oxygen throughout. But when you cross your legs, you're essentially setting up roadblocks in this intricate network. Think about it. When you cross your legs, you're applying pressure to the veins and arteries in your legs. This compression can restrict blood flow, leading to that familiar tingling or numb sensation. You know that feeling when your foot falls asleep? That's your body telling you that blood flow is being compromised. While this temporary numbness is usually harmless and resolves quickly once you uncross your legs, prolonged leg crossing can exacerbate existing circulatory issues. For instance, if you're prone to varicose veins, a condition where veins become enlarged and twisted, crossing your legs can worsen the problem by increasing venous pressure. The bottom line is that maintaining healthy blood flow is essential for overall well-being. While occasionally crossing your legs might not cause significant harm, consistently restricting blood flow to your legs can contribute to discomfort and potentially worsen underlying circulatory conditions. Let's move on to another important aspect of leg crossing: nerve compression. Our nerves are like delicate electrical wires, transmitting signals between our brain and the rest of our body. But when these nerves are compressed, those signals can get disrupted, leading to a range of uncomfortable symptoms. One of the most vulnerable nerves when it comes to leg crossing is the peroneal nerve. This nerve runs down the outside of your lower leg and is responsible for controlling the muscles that lift your foot. When you cross your legs, especially at the knee, you're putting direct pressure on this nerve. Now, imagine maintaining that pressure for an extended period. You might start to experience a tingling or numb sensation in your foot, or even a condition called foot drop, where you have difficulty lifting your foot off the ground. It's like your brain is sending signals, but the message isn't getting through properly because of that compressed nerve. The good news is that these symptoms are usually temporary and resolve once you uncross your legs and relieve the pressure. However, in rare cases, prolonged or severe nerve compression can lead to more lasting damage. You might be surprised to learn that crossing your legs can even have a temporary impact on your blood pressure. Now, before you panic, it's important to note that this effect is usually short-lived and not a major concern for most healthy individuals. However, for people with pre-existing hypertension or heart conditions, it's something to be mindful of. Several studies have shown that crossing your legs at the knee can cause a slight temporary spike in blood pressure. This is because the compression of your veins, which we talked about earlier, can cause a backflow of blood to the heart. This increased blood volume puts extra strain on the heart, leading to that temporary blood pressure increase. The good news is that this effect is usually quite small, and your blood pressure typically returns to normal within a few minutes of uncrossing your legs. However, if you're monitoring your blood pressure or have any concerns about your cardiovascular health, it's always best to err on the side of caution and avoid crossing your legs for extended periods. Remember, knowledge is power when it comes to your health. By understanding how seemingly simple actions like crossing your legs can impact your body, you can make informed choices that prioritize your well-being. So there you have it. While crossing your legs isn't necessarily harmful in short bursts, it's a good idea to be mindful of your posture and circulation. Try to alternate leg positions, sit with your feet flat on the floor, and take breaks to stand and stretch. Thanks for watching, and stay healthy and stay